In early 2022, one morning, I was having a discussion with our emergency team lead, Dr. Allison, and our IHR focal point, Dr. Dipendra. In that, we discussed the recently completed interaction review for COVID-19, which identified multi-sectoral coordination as a key strength to ensure a robust response for COVID-19. At that time, we were also seeing a decline in COVID-19 cases. And therefore, we discussed to reinitiate the discussion on the joint external evaluation, which was initially requested by the Ministry of Health in 2019 to be conducted in 2020. But because of COVID-19, it was not possible to do that in 2020. So just as you all are aware, there is a United Nations General Assembly Resolution 58/3 on enhancing capacity building in global public health, which underscores the importance of international health regulations or IHR. This was followed through in the 58th World Health Assembly. To ensure mutual accountability of state parties and the WHO for global public health security, state parties use the IHR Monitoring and Evaluation Framework or IHR MEF, which includes voluntary participation in the joint external evaluation. Following this, I had a meeting with senior officials of Ministry of Health along with my team, where we explained and outlined the process of the joint external evaluation. I also explained my experience of the joint external evaluation in Timor-Leste. In that meeting, we also emphasized that the joint external evaluation is not an audit. Rather, it is an opportunity to have honest dialogue among national and external experts to formulate priority recommendations by consensus to strengthen health emergency preparedness and response. I also outlined the available online course on IHR Monitoring and Evaluation Framework, which could be a good resource for Ministry of Health officials and other government partners to take before we initiate the process of JEE. During the discussions, it was agreed that we need to proceed with this request to WHO, and therefore a multi-sectoral coordination committee meeting was requested and a briefing was done for all the participants on the JEE process. Following that meeting, there was a consensus to go ahead and request WHO for this joint external evaluation. Once the letter was received from the Ministry of Health, we shared this with the regional office and country office to start preparations for this. But I just wanted to highlight you here that Nepal is already part of this PAR workshop which they conduct to address the involvement of all parties towards submitting the state party assessment and reporting. With this experience, it would be good for Nepal to go ahead with this joint external evaluation. So, following the three-level discussions with the regional office, headquarters and country office, there were steps outlined as to what steps would be taken to go through the process and how much time it would be required for the preparations. It was agreed that it will take at least 6 months to prepare properly for the JEE evaluation to happen in November. Following this, it was important that in the country office, all the focal points were briefed on IHR JEE. Therefore, the team lead, Dr. Allison, made a presentation on the IHR joint external evaluation process to other team leads in the country, which were the immunization team lead, the communicable disease, non-communicable disease, and health system team leads, and asked them to identify focal points in each area in which the WHO emergency team in the office will work with. I also made it mandatory for all the identified focal points in the country office to complete the M&E course to understand IHR Monitoring and Evaluation Framework. Following the completion of the M&E framework, it was also seen that we have a new edition of the JEE tool. Therefore, collectively they went through this new tool which was available and also briefed the Ministry of Health officials and other government officials on this new tool which was available. This helped the country office focal points to engage effectively with government officials and be well prepared for the joint external evaluation. The first step was to jointly identify the various documents which are there and have a repository of all these documents. And if we found that certain documents were only available in Nepali, then we made sure that these were translated in English so that the IHR JEE experts would have access to that information. Parallelly, a process was being followed to identify the 23 experts which were there on these 19 technical areas in consultation with regional office headquarters and country office. And we made it a point that there are certain strong areas and certain weak areas. And the identification of experts would be such that it will help to get robust recommendations to work on the strong areas and also sustain that strengths and to work on the weak areas which are there in the country so that we are better prepared for any emergency. Similarly, as part of the self-evaluation process, many rounds of discussions were had between the technical area focal points within the government and the country office colleagues to complete the self-evaluation forms and agree on the scoring, on the self-evaluation scoring, and what would be some of the recommendations following that. In addition to that, was important that we expose the country office focal point and the Ministry of Health focal point to an ongoing JEE mission in Thailand, which we thought would be very important to help ensure that we are better prepared for the evaluation. So the emergency team in country office and the IHR focal point in the Ministry of Health went to this mission in Thailand. Following their return, the pace of self-assessment was expedited as per the learning from the mission. And also we realized within the country office that we need to give equal emphasis on logistics so that we are better prepared to have those sessions conducted. One additional benefit from this mission was the national focal point for Thailand, who our government official and WHO office interacted with, was finally also selected as one of the experts for the joint external evaluation. Realizing the importance of this joint external evaluation and what it would benefit the country, the Ministry of Health felt that it is important to brief the partners on this joint external evaluation. And I had received several queries from different partners, World Bank, ADB, the USAID, and the DFID on when this JEE process was going to happen. So this briefing helped to update the partners on this. In addition to that, the government colleagues organized a mock presentation led by the Ministry of Health by different technical area focal points. This helped to streamline the presentations across the 19 technical areas and helped to identify what were the strengths, what were the weaknesses, what evidence we had to show progress across all of these technical areas. Then the focus, as I said, was important to prepare on the logistics because we had 23 experts coming from all over the world. So it is important that the operation support and logistic team prepare for their visa processing, their accommodation, getting their travel approvals cleared, and also making sure that the appropriate venue was identified. In November in Nepal is a wedding season, so it was important that we identify a wedding season, during the wedding season, a venue which will be more suitable for this joint external evaluation because there is a plenary area needed, but also there are separate rooms needed for individual discussions with these 19 technical area focal persons. So they identified that and they ensured that the space was available accordingly with all the facilities that are required to conduct this meeting. Also, there were focal points identified from the technical teams and the operation logistics teams which were assigned to the 23 experts, but also to the government focal points to ensure that their presence is there at the required time during these 5 days. So this helped in regular follow-up calls by these technical focal points, and the sessions ran smoothly. As one area finished, the next team was ready with the government and WHO focal points, which helped it conduct smoothly. So just before the mission arrived, the day previous to the joint external evaluation, I had a meeting with my WHE colleagues, focal points, along with the lead and co-lead of the joint evaluation experts. This helped in telling us where we are on the preparations, who are the government officials who were involved, getting familiar with all the experts which were there. And then we had a follow-up meeting with the government and explained to them the 5-day process. To the experts, we made a presentation on the country context, the government structure, and we provided them a profile of all the government focal points with a picture so that they are already familiar with whom they are going to deal with in the next 5 days. So this multi-sectoral involvement and participation and inputs from various ministries was going to be crucial. During the 5-day process, during the technical area, if one technical area did not finish and there was no agreement on the scores and recommendations, there were side rooms already available for the teams to go and have in-depth discussions so that finally there was an agreement and consensus on the scores. Finally, on the 5th day, we had the final scores for all the technical areas and agreement on the recommendations. This was presented on the final day as a plenary in front of all the government officials, but also all the partners who were supporting the government in the area of health, and especially in the area of health emergency and focal points. During this process, there were also certain challenges that we faced. There was an ongoing National Joint Action Review, which was with the Ministry of Health, which also required presence of Ministry of Health officials in that Joint Action Review, including WHO staff. But the government and WHO worked closely to ensure that both processes went simultaneously, and this was because of good, close coordination and collaboration with all the officials. Also, some external experts had their passports expired, which entailed that we are able to adapt quickly and ensure that they arrive on time, even if half a day later, and we managed that. So we had to think of all possibilities that could go right and could also go wrong so that our teams are prepared. And I was able to support the team in whatever decisions they required to ensure that this is completed on time. Now, after the report, the final recommendations were agreed upon and shared with the Ministry of Health, which in turn shared these reports to all the partners and other ministries. Now, how this investment in the joint external evaluation has been utilized by the government, WHO in its own processes and partners. For example, the government has used these recommendations to put it in their annual work plans. What are the key activities that following those recommendations? For WHO country office, we tried to harmonize the JEE and SPAR technical areas and use the SPAR scores which are currently there and to identify the targets for the SPAR scores so that we develop accelerated scenarios and work plans to reach to that target. Simultaneously, there was a WHO initiative which was ongoing, a 100-day challenge, which we were asked to identify key priority areas, and one of the priority areas identified was health emergency management. And we had to develop accelerated scenarios based on the current data which is available and where we need to reach. And therefore, we use this SPAR score to identify and look at the recommendations of JEE, and with close discussions with the regional office and headquarters office, and in discussion, regular discussion through the 100-day process, we identified a clear roadmap of where we want to reach based on the SPAR scores. The roadmap entailed that we invest in human resources and what are the technical activities that we need to invest on and how resources can be raised for this framework. So this is just one example of how WHO has used for its internal processes on its biennial work plan planning and the 100-day challenge. But now the partners have also utilized the recommendations of JEE. The partners, for example, World Bank is currently doing a crisis preparedness gap analysis and using the JEE recommendations as a baseline. At the same time, the United Nations was also developing its cooperation framework for the next 5 years. And so we utilize the recommendations from this JEE to put in this cooperation framework. In addition to that, as part of resource mobilization, there was an opportunity through the pandemic fund proposal, in which we focused on the recommendations of the JEE areas because the fund asked for this, and therefore WHO worked closely with its UN partners FOA and UNICEF, obviously supporting the Ministry of Health to develop a robust proposal where in these three particular areas the sets of actions were already identified, and these JEE recommendations helped to build a very robust proposal which has been submitted now. The other opportunity was the USAID because it was targeting areas as per the recommendations of the JEE, and the actions in the relevant areas which were identified to strengthen health emergency preparedness and response were put in this proposal. In conclusion, the conduct of the JEE throughout the 5-day period owes its success to extensive preparations for 6 months. Also, I think it's a great investment for the country because you saw how it has helped for the government to develop its annual work plans but also mobilize resources. So the journey towards strengthening IHR core capacities necessitates a critical mass of relevant actors who are empowered to have a common understanding of where we are now, how we collaborate and co-create a shared vision of where they would like to be, and who implement the mutually agreed actions by utilizing a common set of information and recommendations for planning, for resource mobilization and action. The experience of Nepal in JEE process and its ongoing utilization of the report is a continuous improvement process involving consultation, action and feedback. It can be argued that significant progress has been made as a result of and resulting from this carefully nurtured culture of open dialogue for preparedness and readiness to disasters and public health emergencies. It is a humble contribution of member state Nepal, enhancing the broader global public health security, ensuring a safer and a healthier future, and also through their local actions. Thank you.